Okay.
All right.
Well, Dr. Chandy John, I want to thank you for joining me for a conversation this week, and really I want to thank you for the breadth of your insight and wisdom and support of me and the Second Presbyterian Church. Really, since the beginning of March, as I was preparing for our conversation, I went back and read the very first email that I sent you on this topic, and it was on March the 3rd. And my question was, do we need to encourage folks to wash their hands? And maybe we do away with the handshake as a part of worship. And from that moment to this one, your voice has been a really important one in my mind and also in my heart as we've navigated these choppy waters of the last few months. And I really appreciate your taking the time to share with the whole congregation some of the conversations we've had, and also kind of a broader conversation about you and your vocation and your work. So thank you for taking the time to be with me.
Great. Yeah, thank you. This is a privilege to do so. Thank you. It's great.
One of the things that, as we've had conversations really over 6 months now, nearly 6 months now, one of the things that keeps popping up in my mind is how we in the Reformed tradition understand what vocation is. And that is that a vocation is a God-given call that uses the gifts that God has given us to serve the world that God loves. And that is a broad understanding of what vocation is. You know, in some traditions, it's, church, that the vocation is restricted to church, but we understand that God calls and gifts people in a variety of ways, that ministry is not unique to pulpits or churches. And so I would just be fascinated, because you're so clearly called to the work that you do. And I'd just be interested in how you understand the gifts that you've been given and how you've put them into practice in the field of medicine.
Yeah, that is a wonderful question, because I always have felt called to this particular type of work. And I think in part it's because my parents are both doctors, and we grew up, they did their residency in Michigan, in Detroit. And so we grew up partly in Detroit, but partly also we went back to India, and they worked at a mission hospital there. So there was always a sense of, even growing up, there was always a sense of they're doing this work that is important. And my mom was a woman doctor, and here a woman doctor of color, at a time when that was really an extremely rare thing. And so there were all these, and especially in churches, like there was a question of, like, should a woman be working outside the home? And, is this right? And so on. And what was really helpful to me was, because of necessity, they were on call at nights, et cetera, mom or dad. And my mother always kind of chose things that would allow her more time with us. But she was an anesthesiologist, and she did have to go in at nights and, take call when she had to do that. And what was helpful to me was to know that they were doing something that was necessary and helpful for other people. And so it wasn't about not having time for us. It was about having time for us and having time for other people. So there was a really good example, I feel like, I got when I was young, that this is a way of being of service to others. And they are still very much of that mind. They're retired from medicine, but they still do a lot of things for other people. And, when I talk to them about stuff, they'll always bring that up, but, like, what are we doing for others? What are you doing for others? They kind of keep me honest in that regard. So they were examples. And I think that, to be honest with you, there was perhaps a slight failure of imagination on my part, come high school and college, because I saw what they did, and I saw how effective it was in serving the underserved. And my greatest love from childhood until now is writing. I love to write and I love to read, but I couldn't see ways in which I could use my writing. And so I went into medicine because I could see how that would help people, that, especially the ones that needed, that were the least served. And so I always had an intention to work in an area where there were less doctors and there were populations that were particularly desperately in need of healthcare. And so that was how my interest in global health started. And I went to University of Michigan for med school, and it was a very academic center. And that was where I realized, like, oh, if I do research, I could I could remain a clinician, but I could serve populations in a different way. And when I went to Bangladesh and Laos and Nigeria and med school and residency, I could see like people were coming back with the same thing, and I was treating them with the same infection, usually, if it was kids. And I thought, like, what if I could be part of the solution to getting rid of that infection? And that's what ended up driving me into research. And interestingly, my love of writing, I write grant applications, I write papers, and so it actually was of great service to that part of the work. But yeah, that's what pulled me into it. And I guess the last thing I'll say is that I didn't understand how much I would love it until I did it. So I really was looking at it as a means to an end. Like, I love writing, but this thing is what's going to actually be useful. But when you get into medicine, and I think in pediatrics in particular, like, kids mostly get better. You see them get better. You're a part of that process. It's extremely fulfilling. So I have really not had. I can get frustrated like everybody else about things that don't go well at work, but I have been so happy and consider myself extremely fortunate to do what I do.
Wow. Yeah. Well, and clearly able to offer a service that you can see its impact. It's impossible to ignore or not be able to see the difference that you make. You remind me, we share that that we've sort of followed in the professional footsteps of our parents. And there's this great line in Marilyn Robinson's novel Gilead, where the author, who is a preacher, whose father was a preacher, says, "My father gave me a profession that turned out also to be my vocation." And it seems like that's sort of the profession was given to you by your parents, but it ends up that's also your vocation. I thought about, while I was away the last couple of weeks, I reread the biography of Henry Ward Beecher, who was the founding pastor of Second Presbyterian Church.
Yes.
And apropos to our conversation, another thing that perhaps draws us together is that I learned that Henry Ward Beecher and his wife Eunice, within their first 3 months of moving from Cincinnati to Indianapolis, both contracted malaria.
Really? Yes, people do not know it was in Indiana, but it was.
Yeah. So not just a tropical disease, at least not in that day.
That's interesting.
Well, obviously, like all of us, that vocation, the work that you do, has been stretched and tried over the last several months. And particularly the work that you do, I know that you've shifted focus, and you've kind of, like so many medical professionals, from public health to infectious disease, really, though, across the medical profession, have sort of retooled and rearranged themselves and their work to serve all of us in this time. And I wonder about kind of the place of your faith in carrying you through the last several months, and perhaps just tell us a little bit about what that's been like on a day-to-day or week-to-week basis.
Yeah, well, I'll start by saying that, as I've told you, I've really appreciated, since we are not able to worship in person, I've really appreciated the services that Second has online. And that has been for all of us, I think I speak for the congregation in saying, has been a lifeline and a place of nourishment on the, for thinking about things spiritual in this very challenging time. And that's really important, I think, because it is exhausting to work in this. It's been very tiring for me, but my adult infectious disease colleagues far more so. We have not seen that many cases in children. It's been more about the preparation and precautions, and how do you think about issues that relate to children when many parents are out of commission with sickness and stuff like that. So it's been a lot of work, but in a very different way from my adult ID colleagues, who at one point were taking care of literally hundreds of people with very severe infection. So but for all of us, I think it's been a challenge, because our regular work doesn't go away. As you mentioned, I work on malaria research as the primary part of my research, and then for infectious disease, I take care of whatever the infectious diseases are that come in. And so on the clinical side, those things didn't stop. the other things, meningitis or Kawasaki disease or standard pneumonias, those all remained. And then there was COVID-19 on top of that. And then on the research side, there's the potential effects of COVID-19 in Uganda and Kenya, where I do my research, which we still don't know exactly what those are. They haven't had nearly as many cases as we have, but capacity for testing and stuff is limited. So thinking about, and then there were studies that we're doing that were shut down because of the lockdown. And so then how do you make sure, if it's a clinical trial, for example, how do you make sure that people are getting clinical care, that they're getting the drug that they're supposed to get and stuff? So there were those challenges. But there's also the challenge of how do you make sure you keep up with those things? Because malaria isn't going to go away. Unfortunately, it may get worse because less resources are being used on it now. And yet, how do you deal with this thing that is important to kids and adults there, and very important right now to kids and adults here? Because we, as a group in our infectious disease division, decided we mostly do global health research. So it's HIV and malaria, and it's mostly overseas. And so we thought very hard about how do we continue to do that and not neglect that, but we all agreed we cannot ignore what's happening in our backyard. These are underserved populations too. It's very striking for us, in kids in particular, because that's what I know, because that's who we're taking care of. I think the African American and Hispanic population of Indianapolis is about 45%, but almost 80% of the kids we've seen with COVID-19 or this multi-inflammatory syndrome in children have been African American or Hispanic. So, we thought we cannot ignore what's happening to these kids and these populations, and we're taking care of them clinically, but we must figure out, why is this happening more? What could we do to make it happen less? I think with the conversations around racism, what role does racism play in this, and what can we do to stop that? And so all of that together, that's a digression, but just to say that that's a lot of work. But I think it helps on both sides. Jesus's call to love your neighbor as yourself is kind of fundamental to thinking about why you do what you do. And it helped for us to say, it may be a little extra work for us, but hey, we all still have jobs, we all still have a salary, we all still have food, and there's a lot of people from COVID-19, in addition to affecting everything else, affected that. So there's many reasons why we need to work on this, but this call that there are things that you have and that other people don't have, and it's your responsibility to make sure that you serve those people. That was one thing. But then I think on the flip side, and as a pastor, you probably know this more than almost anyone, you can just get exhausted by trying to do good, like by trying to do the right thing. And you have to have some sense of, why you're doing it, what your limits are, but also what has driven you to this and where you can get nourishment. So that's why I was saying that the services once a week, it's still once a week, and a reminder of why we do what we do, and the beautiful music. Shelley's been creative about ways of doing that, and a reminder of, that's always a reminder to me of the divine and our connection with the divine. Those things, I think, I'm not sure how people without faith manage to do some of the things that they do, because there are people who profess no faith who do absolutely amazing things. But for me, I need that spiritual nourishment to be able to keep doing this stuff. So I'm just really, really grateful for it.
Well, thank you, and take the opportunity to thank you on behalf of our congregation for the ways you've served us sort of behind the scenes in this time as well. And we've had a number of conversations. I've mentioned, several times we've been able to talk or email a couple of times a week, and I know that's on top of what you're already dealing with, on top of what you had before all of this, and I'm grateful for that. One of the conversations that we had, and I do a lot of phone conversations kind of walking in the neighborhood, and I still remember the place I was standing when you said it, because it sort of stopped me in my tracks. And you said, Chris, church is all about community. And the horrible thing about this virus is that it is the nature of the virus to destroy community. can you talk a little bit about sort of how the virus does that, or what you meant when you said that, and the risks that it poses, sort of especially for congregations or worshiping communities?
Yeah, it is striking to me how insidious the virus is, because we were talking about, I was talking to somebody about um, the the issues with a thing like church, or a gathering at a home, um, where there's a more than a few people gathering. Humans are naturally social beings,
Yes.
and they want to get together. And because of the virus, you can't do that. And so you almost have to say no to those things, because otherwise you tamp down not only natural human responses. What was the person who was talking to me was like, but that's what's beautiful about human beings, and it is
Yeah,
what's beautiful
absolutely.
about human beings.
Yes.
And that's what's so pernicious about the virus. And I think, what we've seen is that um, it's brought out a lot of the best in people, where a lot of us are inspired by the different things that people have done during this time, and how they put their own health on the line for others. And I don't just mean in healthcare, people in,
Mm-hmm.
factories,
Mm-hmm.
teachers, pastors, lots of people who have to have contact for one reason or
Right.
another, and they do because they know that they need to do that for the greater good, and they put them. So that's inspiring. But on the other hand, it's also shown us some sort of the baser side of human nature, people saying like, I won't do this for the group. And so I think that's what um, the, the the way that the virus destroys community is, because we can't be social in the ways, I mean, both physical and just communicative ways that we usually are.
Mm-hmm.
And that makes things so difficult. Like when you and I were talking about church, it's like, well, if church is a church with um, everyone's 6 feet apart, they have to go out 6 feet apart, stay 6 feet apart, they can't sing, everybody has to wear masks, we can't
Yeah.
read together. Like, is this church?
Right.
It's a very, it's tough to say that's a truly social thing. And so in some ways I felt like the ways us being able to do that together online, while far from optimal, at least it works better than something else. So those are the ways in which I think, and I think that this thing of like, there's been, unfortunately, in the past several years, kind of an us against them
Mm-hmm.
mentality in the United States, people on different sides of issues. And the virus has just accented that, because now, things become politicized, or sort of, whatever you want to say, emotionalized.
Mm-hmm.
And then people array themselves into camps. And so again, it's a sort of pernicious way that this
Mm-hmm.
virus in our community is trying to divide us further. And I feel like the role of the church, and for Christians, is to say no, like, we
Mm-hmm.
won't let it do that. But it's pretty hard. It's hard to
Yes.
fight it.
Yes, yes. Well, and to go back to your scripture quote of loving our neighbors as ourselves, that if that's the core call, if that's the basic responsibility of all followers of Jesus, then that's the lens through which we ask this question.
Yeah,
What does it look
exactly.
like to love our neighbors in this particular moment? And yeah, I think a lot about the destruction, or at least temporary separation that we're experiencing, the destruction of community, or the temporary separation we're experiencing. And while for most of us it is temporary, one of the real tragedies is those people who are hospitalized, or who are facing the end of their life and are doing that, and the families who are grieving those losses and forced to do that in separate spaces from each
Yeah,
other.
I can't even
Um,
imagine.
yeah, and that was one of the things that, just as a pastor, and our pastoral team, which does such a fantastic job of visiting folks and staying in touch with folks, we've really had to think differently about what does it look like to be together when we can't physically occupy the same space,
Yeah,
not just in worship, but in pastoral care, and in Bible study and formation, and in all the different kind of, not only are people social beings, but churches are social communities. And so
yeah.
so it's both kind of raised the bar on creativity, and I'm proud of some of the ways we've met that, but it's also been a real challenge.
Actually, if I can say one more thing
Sure.
on that, like you were talking about the church and your groups and communities, and one of the things that has really sustained me is the people I work with. Just like for you, they've completely risen to the occasion. Riley is the most amazing children's hospital, and the people that work there are just gold. And they, before, during, and after the pandemic, they're there for the kids, and that's just a really laser-like focus. But they're also there for each other. And I will say, like, the people in my division, the Ryan White Center for Peds, Infectious Diseases, and Global Health, have just completely risen to the occasion. The workload massively expanded. We had to ask everyone to do stuff that was in addition to something else they were doing, and no one said no. Everybody, and then, like, if somebody was having problems or had too much on their plate, other people would step up. And that's been so, like, when that happens, it just inspires you to, do more.
Yeah, absolutely. Absolutely. And I would say that actually perfect segue to the next thing I wanted to talk about, which is how we are being church, and how the ministries of the church can continue, and not just can, but are continuing. And I know very early on, as folks were kind of reaching out to us and saying, well, what can we do to support? One of the things that we said was, check on your neighbors. What an amazing time to go to the people who are your community. And I have this fantastic email from a member and an elder in our church who said, I didn't really know my neighbors in March. And now we across the street check in on each other and stay distanced, but say, hey, I'm going to the store. Do you need anything? Or she said it's almost become a nightly ritual to check in on our neighbors. And what is more being the church than that? And so we've been able to continue the kind of mission and outreach work of the church. So just this past weekend, we were able to pack back to school kits for our Washington Township neighbors. We're very concerned and engaged with a couple of local elementary schools as they think about an online kind of virtual return to school, especially in communities where internet access and the availability of devices and adults who can help them use those devices are really not the universal norm. Could you talk a little bit about kind of how you see the capacity to continue ministries like that, even as we maintain separation and care for safety of others?
When you say how I see capacity,
what are ways that we can do that and do it safely?
Great. Makes sense. Yeah, it sounds like you're already doing them. I think the key is, like you say, it's a chance to exercise creativity. If our drive did not change, if the mission was to love your neighbor as yourself and to take care of those who have the least, then that's still your mission, and you just have to figure out how to do it. I would say the analogy is to the hospital. Like, okay, we have got to take care of kids who are sick. There's all this COVID stuff. How do we do it? And, again, I'll just give a shout out to my colleagues at Raleigh, the people, at the ground level, cleaning the floors, and nurses and doctors, to the CEO and everyone in between. Like, people came together to devise ways to do this. There was never an option of like, oh, we can't because it's terrible. And I think it's the same thing. Like, it sounds like you've found ways of like making sure there's distance, doing things outdoors when you can do things outdoors. Outdoors is such a great option for so many things. Yes. Another shout out to the Broad Ripple Farmers Market. They've done an amazing job of making it work in an outdoor setting. And really, your risk is just so much lower when you're outdoors because of the diffusion of the viral particles in the air, in flowing air. So, like, if there are things where, I don't know, it's a clothing thing or a thing where people pick things up, having them in individual packets and then people get them rather than you handing them to them, using social distancing, making sure everyone wears masks. I think, as you were saying, considering what the issues are for things like online education, like, it's easy to say, but what are the gaps going to be there, and how can the church work? So I think a lot of it also is about what are the new issues and what are things that the church could contribute that weren't in your budget line before because that wasn't, an issue before.
Yes.
So I feel like uh, knowing your core mission, which this church knows so well, and then saying, okay, since we can't do it by ways A or B or C, what are the other things we can do to do it? And honestly, some things you end up not being able to do.
Mhm,
You know, that's just
mhm,
reality.
mhm,
Like, you know, having large gatherings where
mhm.
everyone's close together. But there are lots of things you can do. So,
Yeah, yeah. Well, just as your colleagues have shifted and taken on more and done so willingly and with great adaptability, I would say not just the staff of the church, but the membership of the church. You know, we've had record-breaking months for our food pantry, and that's something you wish weren't true. But those are the kinds of effects that will continue, and sadly, the economic devastation and the loss of jobs and the increase in hunger. So it seems to me that we are called kind of back to our basic mission, as you said, in new ways. So we have a drive-through food pantry instead of a come sit in the
oh,
church
that's
food
great.
pantry, but we can still give out food. Or we have a blood drive, but instead of having everybody gather in the church to do that, we bring the blood mobile, and they, have people in and out, but we're still able to provide what is, I know, a really critical need right now for blood as well. And so, yeah, the creativity that in some ways I'm not sure we were even aware of our capacity to tap into. I think we've become
Yeah,
more
that's
creative in
true.
some ways than we knew was possible. Certainly I feel that some days.